Your lifestyle, sleep habits, nutrition habits, your social environment, your family environment. For example, I will not take it right now. Biomedical healthcare model 1. Psyche means mind. Mind has an influence on the body. For example, somebody is very much stressed. Their gastrin hormone will increase. This gastrin hormone in turn will increase your hydrochloric acid. Hydrochloric acid will cause you acidity. What is the treatment? Google Baba will tell you, any doctor will also tell you, or you yourself will go and tell the doctor, sir, acidity आगे ಸ್ವಲ್ಪ antacid बरकोड़ी. Acidity हुआ है थोड़ा antacid लिख के दे दो sir, कोई भी आपका brand. This will go and tell the doctor. How many of us will do this? Because information overload. Google Baba, Google Doctor is helping you everywhere. But access sites which are authentic in nature, who have information which are like WHO, all authentic information. Take it. So, what's happening in this world? These two healthcare models. Everybody throughout the world are focusing on the biomedical system. Eye doctor, ortho doctor. Somebody is having stomach pain will say go to a gastroenterologist. What is the fees? 800 rupees. Okay, go get it done. Okay, sir. How many days you are having acidity? 2 weeks. Oh, let me see. Because doctor will be thinking, as straight naked truth is, doctor is hired there paying 1.5 to 3 lakhs or 5 lakhs rupees. Corporates has to get back that money. What to do? Lab investigations. Okay, please get this lab investigation done. Some corporate things are very notorious. Some people are little honest and straightforward, but they have high charges. You got my point? We go to endoscopy. Put the pipe in your stomach, see it. Okay, while putting the pipe, there will be some other erosions happening already. And we'll give you 2 weeks of medicine and you go. But we never tell you that doctors don't have time, because super specialty is so high that doctors don't have time. When he has a target, 30 patients, okay, 10 minutes each, I'll get this. Out of that 5 to 10 people, I need to send for lab, at least 3 for MRI, at least 10 for complete blood count. You got my point? Then only those corporates will get some 30%, 20% money to give it back to that doctor. So we are trapped into the corporatization. So there are very few people who wants to think of preventive healthcare or integrative medicines. Some of them are with you. One is there, who is there? One is here, Sambit Mohanty ji. One is sitting somewhere far at the back hiding. There will be Anirban Chaudhary. One more new is our Solimi Day madam. There will be very few people. Why? Because preventive healthcare do not earn any money. Very straight truth. So one more hard truth is 56 million people die every year. WHO statistics. Out of that, 71% of people die because of non-communicable diseases. It means diseases which will not spread from one person to another person, but still we are dying. Out of them, 4 most common are, first one is heart related issues, hypertension, heart related issues, cardiac, heart attack or something. Second one is cancer. Third one is chronic obstructive pulmonary disease, lungs related issues. Fourth one is diabetes, metabolic syndrome. These 4 are the most common non-communicable diseases. Why we need it? We are the world's number 1 people in the diabetes. We are world's number 1 because our genes are as such. An American with big tummy, pot belly. American with a big pot belly, he will not get diabetes so early compared to an Indian with little pot belly. Pot belly suggests that you are settling in your life, so fat will settle in. Is it not? The fat will get accumulated in the dependent areas. So, for this 70% of people who die because of non-communicable disease, they don't know where to go, where we should go. For example, how many of, because you are youngsters, you do not understand this. How many of you or your parents have diabetes? Raise your hands. You see the statistics now. How many of your parents or people, friends, uncle, aunties have a hypertension?